The United States Medical Licensing Examination, or USMLE, Step 3, marks a significant milestone in your medical career. Be sure to watch our video about what to expect on Step 3 if you haven't seen it. This video is emphasizing examples of questions and clinical reasoning behind the correct answers. This exam evaluates your ability to apply medical knowledge and clinical judgment in diverse clinical settings. Achieving a high score on Step 3 can significantly enhance your residency applications. Program directors often use Step 3 scores as a metric to assess a candidate's clinical knowledge and decision-making abilities. A strong performance on this exam demonstrates your commitment to professional growth and your ability to handle the demands of residency training. A good score can give you a competitive edge, particularly in highly specialized fields where competition is fierce. Furthermore, some residency programs may require you to pass Step 3 before starting your second year of training or for advancement within the program. Step 3 goes beyond assessing your medical knowledge. It evaluates your ability to apply that knowledge in simulated real-life scenarios. The exam presents you with complex patient cases that require you to make critical decisions regarding diagnosis, treatment, and management. This simulates the challenges you will encounter in your future medical practice, where you will need to analyze patient information, interpret test results, and formulate effective treatment plans. Your performance on Step 3 provides valuable insights into your clinical reasoning skills, which are essential for providing safe and effective patient care. Step 3 is a comprehensive 2-day examination. It is known for its challenging nature, requiring not just rote memorization, but a deep understanding of medical concepts and their practical application. This exam assesses your ability to integrate knowledge from various medical disciplines, make sound clinical judgments, and provide patient-centered care. This guide aims to provide you with a clear understanding of the exam's structure, question formats, and content. We will delve into key multiple-choice questions, providing detailed explanations and strategies to approach them effectively. Step 3 is structured as a 2-day examination, carefully crafted to assess your readiness for unsupervised medical practice. Unlike previous steps, this exam extends beyond basic science knowledge to evaluate your ability to apply your knowledge in real-world clinical settings. This 2-day format mirrors the dynamic nature of medical practice, where physicians often manage multiple patient cases and make time-sensitive decisions. Understanding the structure of each day is crucial for effective preparation and optimal performance. The first day focuses on assessing your foundational knowledge and skills essential for independent practice. You will encounter multiple-choice questions covering a wide range of medical disciplines, including internal medicine, surgery, pediatrics, obstetrics and gynecology, psychiatry, and more. This day emphasizes your ability to diagnose and manage common medical conditions, interpret diagnostic test results, and apply basic medical knowledge. It lays the groundwork for the more complex scenarios you'll encounter on Day 2. Day 2 of Step 3 delves into more complex medical situations, demanding a higher level of clinical reasoning and decision-making. You will be presented with detailed patient case simulations, requiring you to gather information, order tests, interpret results, and make critical management decisions. This portion of the exam also includes a component called computerized case management, which assesses your ability to manage patients over time, adjusting treatment plans based on their responses and evolving conditions. The majority of Step 3 questions are presented in a multiple-choice format. These questions are designed to test not only your medical knowledge, but also your ability to apply that knowledge to clinical scenarios. Each question typically presents a clinical vignette followed by a question stem and several answer choices. Only one answer choice is the best answer, while the others may be partially correct, incorrect, or even harmful in the given clinical context. While knowledge of medical facts is essential, Step 3 goes a step further by evaluating your clinical reasoning abilities. This involves analyzing information, interpreting data, solving problems, and making sound clinical judgments based on the presented evidence. The exam challenges you to think critically about patient presentations, differential diagnoses, appropriate investigations, and the risks and benefits of various treatment options. Mastering clinical reasoning is key to succeeding on this exam and excelling in your medical career. Hypertension is a common cardiovascular condition. A patient has a blood pressure of 150/95 mmHg, is currently on lisinopril 20 mg daily. The next step? Add amlodipine to achieve optimal blood pressure control to reduce cardiovascular risk. Managing asthma, particularly during exacerbations, is a vital skill. Identifying the severity and administering the right treatment can avert complications. A 25-year-old female with a history of asthma arrives at the emergency department with shortness of breath. She has used her albuterol inhaler several times without relief. On examination, she has a respiratory rate of 28 breaths per minute, wheezing, and a peak expiratory flow rate of 45% of her predicted value. What is the next best step in management? Is it A, intravenous methylprednisolone, B, oral prednisone, C, continuous nebulized albuterol, D, intravenous magnesium sulfate, or E, non-invasive positive pressure ventilation, NIPPV? It is continuous nebulized albuterol. In acute asthma exacerbations, the primary goal is to quickly relieve bronchospasm and enhance airflow. Continuous nebulized albuterol offers sustained bronchodilation and is the first-line treatment for moderate to severe exacerbations. Intravenous methylprednisolone and oral prednisone are crucial for reducing inflammation, but they are not the immediate intervention needed to relieve acute symptoms. Intravenous magnesium sulfate is reserved for severe exacerbations that do not respond to initial treatments. NIPV may be considered an impending respiratory failure, but is not the initial step here. Prompt and effective treatment of asthma exacerbations can significantly reduce morbidity and prevent the necessity for more invasive interventions. Chronic hepatitis B infection requires careful management to prevent long-term complications such as cirrhosis and hepatocellular carcinoma. A 40-year-old male is diagnosed with chronic hepatitis B. His laboratory results show HB-Sag positive, HB-Ag negative, and HBV DNA 20,000 IUML. His liver function tests are within normal limits. What is the most appropriate next step in management? Is it A, start entecavir, B, monitor liver function test every 6 months, C, start tenofovir, D, perform liver biopsy, or E, vaccinate against hepatitis? It is to start tenofovir. Chronic hepatitis B infection management depends on viral load, HB-Ag status, and liver function. This patient has a significant viral load, 20,000 IUML, and is HB-Ag negative, indicating active infection despite normal liver function tests. Starting antiviral therapy with tenofovir is appropriate to reduce viral load and prevent progression to cirrhosis or hepatocellular carcinoma. Entecavir is another option, but tenofovir is often preferred due to its efficacy and resistance profile. Monitoring liver function tests every 6 months is important but not sufficient alone. Liver biopsy is not indicated unless there is a suspicion of fibrosis or cirrhosis. Vaccination against hepatitis. A is recommended but is not the immediate next step. Understanding the indications for antiviral therapy in hepatitis B is crucial for preventing long-term liver damage and ensuring patient outcomes. Acute stroke management is time-sensitive and requires rapid assessment and intervention. Stroke symptoms present. CT scan shows no hemorrhage. Administer intravenous tissue plasminogen activator, TPA. TPA within 4.5 hours of symptom onset is the standard of care. Managing diabetes involves not only controlling blood sugar levels, but also preventing complications through comprehensive care. A 60-year-old male with type 2 diabetes presents with a hemoglobin A1C of 9.2%. He is currently on metformin 1,000 milligrams twice daily. What is the most appropriate next step in management? Is it A, add glipizide, B, add insulin glargine, C, add sitagliptin, D, increase metformin to 2,000 milligrams twice daily, or E, advise dietary modifications? It is to add insulin glargine. For a patient with type 2 diabetes and an HbA1c of 9.2%, indicating poor glycemic control, the addition of basal insulin, insulin glargine, is appropriate to achieve better blood sugar regulation. Glipizide, a sulfonylurea, can be added but may not be sufficient alone for such elevated HbA1c. Sitagliptin, a DPP-4 inhibitor, is another option but less effective than insulin in this scenario. Increasing metformin beyond the maximum recommended dose is not advisable. Dietary modifications are essential but need to be combined with pharmacotherapy for this level of glycemic control. Effective management of diabetes requires a combination of lifestyle changes and appropriate pharmacologic interventions to minimize complications and improve patient outcomes. Febrile seizures are common in young children and require specific management strategies to ensure safety and prevent recurrence. A 2-year-old girl is brought to the emergency department after a generalized tonic-clonic seizure lasting 2 minutes. She had a fever of 101 degrees Fahrenheit. There is no past medical history of seizures. What is the most appropriate next step in management? Is it A, perform lumbar puncture, B, administer antipyretics, C, start anticonvulsant therapy, D, order an EEG, or E, reassure parents and observe? It's to administer antipyretics. Febrile seizures are typically benign and self-limiting, occurring in the context of a febrile illness. The primary management involves controlling the fever with antipyretics like acetaminophen or ibuprofen. A lumbar puncture is indicated if there are signs of meningitis or the child is very young, under 12 months. Anticonvulsant therapy is unnecessary for a simple febrile seizure. An EEG is not required unless there is suspicion of an underlying epilepsy. Reassuring parents and observing the child is also important, but should be combined with fever management. Understanding the management of febrile seizures helps in providing appropriate care and reassurance to parents, reducing unnecessary interventions. Preeclampsia is a significant condition in pregnancy that requires immediate and appropriate management to prevent maternal and fetal complications. A 28-year-old pregnant woman at 32 weeks gestation presents with a blood pressure of 160 over 100 millimeters of mercury and 3+ proteinuria on dipstick. She complains of headaches and visual disturbances. What is the next best step in management? Is it A, admit for observation, B, administer intravenous magnesium sulfate, C, start oral labetalol, D, perform an immediate cesarean section, or E, increase prenatal visits? It's to administer intravenous magnesium sulfate. The patient's presentation is consistent with severe preeclampsia, characterized by high blood pressure, significant proteinuria, and symptoms indicating end organ involvement, headaches, visual disturbances. Administering intravenous magnesium sulfate is crucial to prevent eclampsia, seizures, and manage severe preeclampsia. Starting oral labetalol can help manage blood pressure but is secondary to seizure prevention. Immediate cesarean section is not indicated unless there are signs of fetal distress or maternal instability. Increasing prenatal visits is important for monitoring but does not address the acute condition. Prompt and effective management of preeclampsia is essential to prevent severe complications for both the mother and the fetus, highlighting the importance of recognizing and treating this condition early. Managing major depressive disorder involves a combination of pharmacotherapy and psychotherapy to achieve remission and improve quality of life. A 35-year-old female presents with a 3-month history of low mood, loss of interest in activities, fatigue, and disturbed sleep. She has no history of psychiatric disorders. What is the most appropriate initial treatment? Is it A, cognitive behavioral therapy, B, start sertraline, C, refer to a psychiatrist, D, start bupropion, or E, encourage exercise and lifestyle changes? It's to start sertraline. For a patient presenting with symptoms of major depressive disorder, starting an antidepressant such as sertraline, a selective serotonin reuptake inhibitor, is appropriate. CBT is also effective and can be combined with pharmacotherapy, but starting medication often provides quicker relief of symptoms. Referral to a psychiatrist may be necessary for complex or treatment-resistant cases, but is not the initial step. Bupropion is another antidepressant option, but is typically considered if SSRIs are not effective or cause side effects. Encouraging exercise and lifestyle changes is beneficial, but should complement, not replace, pharmacotherapy. Effective management of major depressive disorder requires a multifaceted approach, combining medication with therapy and lifestyle modifications to achieve the best outcomes. A 62-year-old African-American male with a history of hypertension presents with a severe headache. He describes it as the worst headache of his life. He also reports nausea and blurry vision. His blood pressure is 220 over 130. This suggests a hypertensive emergency. The goal is to lower the blood pressure gradually with IV medications. Admit to ICU for close monitoring and start IV therapy. A 7-year-old boy with asthma is brought to the emergency department. He has been having increasing difficulty breathing. His albuterol inhaler has not provided much relief. He is using his accessory muscles to breathe. He has a high-pitched wheezing sound. His respiratory rate is 36 breaths per minute. This child is experiencing a severe asthma exacerbation. A patient has no significant medical history and is not taking any medications. She denies any recent illness, fever, or fatigue. Her physical examination is unremarkable. As part of her routine blood work, she undergoes a comprehensive metabolic panel, which reveals elevated liver enzymes. Further testing reveals positive hepatitis B surface antigen, or HB-Sag. This patient's case highlights the importance of routine screening, as she is asymptomatic but has laboratory findings consistent with chronic hepatitis B infection. Chronic hepatitis B can be silent for years. A common finding in liver disease, including hepatitis B, confirms the diagnosis of hepatitis B infection. The next steps involve further evaluation to determine the stage and activity of the infection, as well as assessing for any liver damage. Order additional blood tests, including hepatitis B antigen, or HB-Ag, hepatitis B viral DNA levels, and liver function tests. Perform liver imaging, such as an ultrasound or transient elastography, to assess for fibrosis or cirrhosis. Consider referral to a hepatologist for further management and discussion of potential antiviral therapy. Counsel the patient on the importance of preventing transmission to others, including vaccination of close contacts. A 72-year-old female with a history of hypertension and atrial fibrillation presents to the emergency department with sudden onset of left-sided weakness and slurred speech. Her husband reports that she was having breakfast when he noticed her symptoms. On examination, she is alert but has significant left-sided weakness, facial drooping, and difficulty speaking. This patient's presentation is highly suggestive of an acute ischemic stroke. Time is of the essence in this situation, as prompt intervention can significantly improve outcomes. Here we had classic presentation of stroke, significant risk factors for stroke, consistent with a specific area of brain involvement. The immediate goal is to assess for eligibility for thrombolytic therapy, or TPA, and to initiate treatment as soon as possible. Immediately activate the stroke team and obtain a stat head CT scan to rule out hemorrhagic stroke. If eligible for TPA, administer it intravenously within the appropriate time window, which is 4.5 hours from symptom onset. Closely monitor her neurological status, blood pressure, and glucose levels. Admit her to the stroke unit for further management, including rehabilitation and secondary stroke prevention measures. A 55-year-old male with a 10-year history of type 2 diabetes presents to his primary care physician for a follow-up appointment. He admits to not following his recommended diet and exercise plan. He has also been inconsistent with his medication regimen, often forgetting to take his metformin. His hemoglobin A1C level is 10.5%, significantly elevated from his last visit. This patient's uncontrolled diabetes and poor medication adherence put him at high risk for developing serious complications. Diet and exercise play a crucial role in diabetes management. A major barrier to achieving glycemic control indicates poor long-term blood sugar control. The focus should be on educating the patient about the importance of diabetes management, addressing barriers to compliance, and intensifying his treatment regimen. Have a detailed discussion about the potential long-term complications of uncontrolled diabetes, such as heart disease, kidney disease, neuropathy, and vision problems. Work with the patient to develop a realistic and achievable plan for diet, exercise, and medication adherence. Consider adding additional oral or injectable medications to improve his blood sugar control. Refer him to a diabetes educator and a registered dietitian for further guidance and support. An 18-month-old girl is brought to the emergency department by her parents. She experienced a seizure at home. She had a fever of 102 degrees Fahrenheit earlier in the day. While playing, she stiffened, rolled her eyes, and began shaking. The episode lasted about a minute. This describes a typical febrile seizure, common in young children. Simple febrile seizures are usually benign. They occur between 6 months and 5 years. Management focuses on reassurance and fever control. Educate parents about febrile seizures and fever management. Reassure them that febrile seizures do not cause lasting harm. As you embark on your Step 3 journey, remember that consistent practice and strategic preparation are your greatest allies. Approach your study plan with the same discipline and dedication you've demonstrated throughout medical school. Utilize high-quality review resources, including comprehensive textbooks, question banks, and online platforms. The more you practice, the more comfortable you will become with the content. Questions on Step 3 are designed to assess not only your medical knowledge, but also your ability to apply that knowledge clinically. Develop a systematic approach to question analysis. Read each question stem and vignette carefully, highlighting key information and identifying the patient's primary problem. Carefully consider each answer choice, eliminating those that are clearly incorrect or not supported by the information provided. Develop a rationale for your chosen answer, ensuring it aligns with the question stem and the clinical scenario presented. Step 3 goes beyond rote memorization. It evaluates your clinical reasoning and decision-making skills. Strive to understand the why behind medical concepts and treatment algorithms. Imagine yourself as the physician caring for the patient presented in the vignette. Consider the differential diagnoses, appropriate investigations, and potential complications. Develop a clear and concise thought process to guide your clinical decisions and justify your chosen management plan. Step 3 is undoubtedly challenging, but also a testament to your growth as a physician. Embrace the challenge with a positive mindset and a commitment to excellence. Believe in your abilities, draw upon the knowledge and skills you've acquired, and approach each question with confidence. Remember that your journey to becoming a licensed physician is a marathon, not a sprint. Your dedication, perseverance, and unwavering commitment to patient care will guide you to success on Step 3 and beyond.